Let me see if we have everybody on board to get started with the webinar. I think we can wait a few seconds more for participants to connect, and we will join you shortly. Thank you for your time. Good afternoon, everyone. Hope you hear me well. My name is Mari Pazade. I'm part of the regional malaria team here at the Pan American Health Organization, and I will give you an introduction of this webinar. So welcome everyone to the 2023 World Malaria Day webinar. This afternoon, we will have a very brief agenda, starting with a message from our director, Dr. Jarbas Barbosa, following some welcome remarks by Dr. Roberto Montoya, our Malaria Regional Advisor. Furthermore, a video celebrating some efforts against the malaria. And then our colleague, Dr. Janseme Alexandre, will launch the call for 2023 Malaria Champions in the region. And at the end, we will have a brief section for questions and answers. So welcome, everyone. And with further ado, please, let's move to the video, a message from our director, Dr. Jarbas Barbosa.
Today is World Malaria Day. It is the right time to urge mobilization of resources and support towards malaria elimination in the Americas. Malaria elimination efforts in the region have yielded positive results in achieving the targets set in several endemic countries. Since 2019, 3 countries of the Americas, Argentina, Paraguay, and El Salvador, have been certified malaria-free, and Belize will possibly join soon, having reported 0 indigenous malaria cases for the 3rd consecutive year. Malaria is a life-threatening disease caused by parasites that are transmitted to individuals through the bites of infected mosquitoes. Let me remind you that malaria can be prevented, cured, if early treated with effective treatment and eliminated. Instead, malaria continues to be a major public health challenge, and it disproportionately affects the most marginalized populations in the region. We have the tools needed to provide these populations with highly effective diagnosis, treatment, and prevention interventions. But we need to set up our efforts and tailor responses to specific settings, engage local communities, facilitate country ownership, strengthen primary health care, and ensure sustainable funding to maintain progress towards elimination. Let's build on the multiple success stories of the Americas. Today, join me in celebrating all Malaria Champions, recognizing the very institutions and communities those stepped up efforts against the disease since 2009. I am pleased to invite nomination for the new champions, who will be honored on Malaria Day in the Americas in November this year. I invite diverse actors around the region, governing entities, universities, private sector, NGOs, and persons or groups of persons who have led an impactful malaria effort to participate in this initiative. Eliminating malaria is possible. It must be a priority in our region to ensure that all affected communities have no barriers to access early diagnosis and treatment. We can do it together.
Hello, everybody, and thank you for being here to celebrate the World Malaria Day. And today, in the World Malaria Day, the message promoted by the World Health Organization is about these three I's. Invest, because it's still needed more investment in malaria in the world, in improving the health systems, in improving also access to primary health systems. Innovate, because there is still a need of innovation in diagnosis, in treatment, also in vector control, but also not only in technology. It's very important in malaria to innovate still more in improving the local implementation. And finally, implement. This is the key word for today, because too many people at high-risk areas, and particularly in our region, are still missing out of the service. In the Americas, we have particular challenge in reaching marginalized and hard-to-reach populations. I really believe that we have the tools, but our endemic countries are still facing important gaps on making those tools available, particularly for the most affected population and marginalized populations. The region is making very important progress in eliminate malaria. Here we have the countries that have been certified as malaria-free in the last years. Belize is also on that path, after having reported 0 indigenous cases since 2019. However, there are still many challenges. Despite the achievements in elimination in the region, we have many challenges with countries that are facing important number of cases. This is the situation in our region in terms of number of cases. And despite the significant reduction in cases during 2020 and 2021 and 2022, we need to recognize that the region is still far of the target for 2025. The target in terms of cases for 2025 is 120,000 cases, but our countries are reporting more than 400,000 cases. I am sure that we can return to the situation in 2015, but we need to ensure access to malaria interventions, particularly for the most vulnerable populations. We need to implement, and that is why it's very relevant, the proposal from WHO to promote today this special message. So today, this webinar is about these gaps, the challenge of accessing the most marginalized population, indigenous people in the Amazon region, but also in Central America, in the Mosquitia, in El Darién, in Panama and Colombia, in the Pacific coast, migrant populations, mobile populations, particularly agricultural workers, and other populations that are really hard to reach. Those who are the more disproportionately affected by malaria. Agricultural workers and their families, some of them working in illegal conditions, are among those more vulnerable populations affected by malaria in our region. These people usually have different barriers for accessing health services. The populations in border areas, some of them are mobile populations living in areas with different gaps in terms of access to health services. Also, the situations in urban areas. This photo is from a big city in the Amazon region. Populations in these situations are also among the more vulnerable and face different challenge in accessing the malaria services. This is also what we are talking today, vulnerable populations in the context of gold mining, which is one of the most important determinants of malaria in the Amazon region. The call today is for a more ambitious response in malaria, and particularly for a very ambitious actions to provide access to diagnosis and treatment without any barrier to all the populations. From the regional malaria team in Pajo, we are promoting this change. This is not the same that we are doing now. No, this is more. We need to do more in terms of improving access to diagnosis and treatment. We need to maximize the use of rapid tests in different areas. We need to make the treatment as a public good in all the communities. Diagnosis and treatment in all the health facilities. Expand the reach of community agents, community health workers. Involve more actors from the community. Recognize and approach the cultural barriers for accessing early diagnosis and treatment, and increase also the funds of malaria. This is among some of the key change that we believe is necessary to do in order to expand access to diagnosis and treatment in our region. Maybe the most important intervention that we need to promote in terms of the elimination of malaria in the continent. The other key element to improve the implementation is the idea of organizing the interventions at the very local level. It is definitely necessary to establish operational units. This is about microepidemiology, and this is about organizing the local teams responsible for eliminating the malaria in those foci, in those units. And this is also about improving the use of data at the local level, and about the adaptation of the actions to the local specific context. So since 2019, the Malaria Champions initiative have recognized the achievements of and efforts of the countries, local actors and communities in the fight against malaria in our region. And most of those experiences have been actually recognizing efforts in marginalized populations. So it's very related what we are celebrating and promoting today. So with this, I want to introduce the next session of this webinar, which is about the nomination of the candidates for Malaria Champions this year. I believe that we have the opportunity with the Malaria Champion initiative to promote additional efforts to approach the more marginalized and vulnerable populations in our regions. So let's start with this short video that is mostly about the implementation of malaria actions in those marginalized populations. Thank you.
¿Qué define a un campeón? ¿Es aquel quien llega a una meta de primero o aquel para el cual esa meta es solo el punto de partida de muchas más? ¿Es un campeón egoísta o sus sacrificios, perseverancia, convicciones, dudas y triunfos son para inspirar y compartir con los demás? ¿Se retira un campeón ante la primera dificultad o enfrenta cada adversidad, se levanta y continúa el camino porque sabe que en su esfuerzo estamos todos los que creemos en él. Un campeón es todo eso: inspiración, sacrificio, perseverancia, creer, compartir, humildad. Un campeón frente a todas las adversidades llega a la meta para volver a empezar. Con una idea visionaria y frente a la urgencia de hacer frente a la malaria, nace en el 2009 la iniciativa Campeones de la Malaria en las Américas. Su objetivo es identificar y honrar los esfuerzos innovadores que han contribuido significativamente a superar los desafíos de la malaria en la región. Al mismo tiempo, continuar apoyando el trabajo de campeones anónimos que creen que esa línea que divide a los que tienen y los que no se puede borrar. Por 13 años, y bajo diferentes temas, en las comunidades más remotas, en circunstancias adversas, la Organización Panamericana de la Salud fue testigo del trabajo y sacrificio de verdaderos campeones. Se estima que más de 100 comunidades de 15 países de la región han sido impactadas positivamente, directa e indirectamente, por esta iniciativa. Esta es su historia. 2009. Superando los desafíos de la malaria en las Américas. (2010) Enfoques innovadores para llegar a los grupos de alto riesgo de malaria. (2011) Fortalecimiento de los elementos de apoyo para superar los desafíos de la malaria. (2012) Mejores prácticas en el diagnóstico, las pruebas, el tratamiento y la vigilancia de la malaria. (2013) Esfuerzos integrados contra la malaria para lograr objetivos clave. (2014) Mejora de la gestión integrada de vectores para prevenir la malaria. (2015) Esfuerzos contra la malaria que contribuyen al logro de los Objetivos de Desarrollo Sostenible. 2016. Esfuerzos contra la malaria que contribuyen a la eliminación de la transmisión local de malaria. 2017. Esfuerzos contra la malaria que contribuyen al acceso universal. 2018. Esfuerzos contra la malaria que contribuyen a fortalecer el sistema de salud. 2019. Esfuerzos de los municipios de alta carga para reducir la transmisión de la malaria. 2020. Mejores prácticas en paludismo en municipios de alta carga durante la pandemia de COVID-19. 2021. Municipios de alta carga con carga reducida de malaria. La iniciativa Campeones de Malaria en las Américas ha estimulado los éxitos de los programas de control de la malaria en la región y preparado el camino para los próximos pasos. Los que continúan en esta tarea pueden avanzar firmes, seguros y confiados de que en la marcha encontrarán otros campeones, otros héroes anónimos, para juntos crear más comunidades libres de malaria. La Organización Panamericana de la Salud reconoce y honra la invaluable labor y dedicación de los campeones de malaria en las Américas en su incansable tarea de construir comunidades libres de malaria.
Thank you very much. Good afternoon, everyone. Again, welcome for joining us in the celebration of this edition of World Malaria Day 2023. I'm going to show my slide. Good. So a very inspiring video that is really linking to the presentation I'm about to do. So what we are trying to do now is to link this celebration of World Malaria Day 2023 to the Malaria Championship. We've seen in this video that we've just seen the different champions that we've had from 2009 to 2021, 13 years of history. Last year, we've reviewed the initiative of a Malaria Champion for three reasons that we are showing here, mainly to better respond to current and future challenges, to promote greater appropriation by the Ministry of Health, national and local actors, and to further support with the national championship to support the efforts that are being deployed at the national level in their strategy and the different plans being implemented at the national level. So when we reviewed the initiative last year, we came up with three main ideas that we wanted to continue promoting with the Malaria Champion initiative. Number one is to have a greater recognition for more sustained actions. The second point was to have more than one team and more than one champion every year. As we've seen in the video, every year we could have had more than one champion, but on one team. With the new initiative, we want to explore all good practices that we want to emulate, that we want to showcase, that can be used by other countries to implement their national strategies, so that we can have all of them can be recognized and all of them can be promoted. And the third point is about to have the experiences duly documented by the countries. So the plan here is to have more involvement by the ministries or the local actors documenting what they want to be recognized as Malaria Champion in the Americas. So based on that, this year, the 2023 edition of World of Malaria Champion in the America has been launched, and teams that have been considered, you can see that they are related to the World Malaria Day team that Dr. Montoya just presented. One of them is the first one we have in the bullet here, the malaria reduction in population living in difficult to access area. We can also consider in the different localities a high burden municipalities effort to reduce malaria cases, access to diagnosis and adherence to treatment. One of the main subjects that have been that we are promoting from the regional program, innovative operating models, knowledge and evidence, new tool. We can have other teams like collaborations that target malaria and produce reduction in number of cases, theme like malaria elimination, or specifically Plasmodium falciparum elimination, or other themes, any other theme, where we can have, where we can see a good impact in malaria control and elimination, can be considered for Malaria Champion. So as the 2023 edition has been launched, in the term of reference, we have described about how or who may apply. Actually, this is just taking back on the discussion that have been done last year that have been agreed with the countries. So who may apply? We've listed here different candidates that can apply, but we see that we can understand that this list is not exhaustive. Ministry of Health or subnational program can apply in big countries where we have state secretariat of health, where we have regional health authorities, where we have local malaria programs. Of them can apply. Municipalities can apply. Local health network, a mayor's office, a municipality health secretary, any entity that is contributing in the fight against malaria and is having a good impact that want to be showcased can apply. A person or a group of persons having led an impactful malaria effort can apply. NGOs working in malaria can apply. The university research group coming up with innovative ideas to target or to reduce malaria or to eliminate malaria can apply. The private sector involved in the fight against malaria who have had a good, impactful result can apply it for Malaria Champion. Any malaria stakeholders, as we see here, can apply. And also, we are promoting anyone who knows someone, who knows an entity, an NGO, or an institution having had a good effort in Malaria Championship can apply on behalf of this third party. So, how do we apply? We can first obtain detailed information on the PAHO webpage. We get into paho.org. In the paho.org, we have different the 4 different official languages we can have access to. When we get there, we go, and the next step we look for, we roll down, we look for the malaria link. Then when we get into this malaria link, we will see the call for nomination. Then when we click on it, we will have the different languages, French, Portuguese, English, and Spanish available. So in this page for the call for nomination, we have the details about how to apply, who may apply, all the details related to the Malaria Championship for this year. As I've said, it is in the different languages, and we also use social networks. All the PAHO social network, these call for nomination, information about the call for nominations is there. So the application process for the Malaria Champion this year is a two-step process, phase 1 and phase 2. In phase 1, we will be receiving the expression of interest, which is a very simple process. I'm going to look into it with you just in the next slide. And the second phase is about the detailed documentation. Let's see what do we have in each one of these phases. Phase 1, how to apply phase 1. There is a one-page form in the web page that I've just showed, where we get to fill the form. We have 3 simple segments in the form. We fill it and we return it to the PAHO country office wherever the candidate is, or it can be directly sent to this email address, Alexander J at parho.org. Now, what do we see in this form, this one-page form for the expression of interest? In the first section, we need to write down the nominee profile. A nominee profile can be a University of Columbia who has worked on an innovative idea that will help us control or target a specific aspect of the malaria control and elimination. And then for the profile, the nominee profile, we would write the University of Columbia. I'm just using an example. And then the team, what the university has done that need or we want to submit as a candidate for championship for Malaria Champion in the America 2022. The team is in the second section. So it's short, maximum 50 words. And then this theme, we're going to describe what is it. We've seen in the different champions that have been projected in the previous video. I believe the last one was about a high burden municipality. So I want to present one municipality, that means one major office in one municipality that have helped in the fight against malaria to reduce the number of cases in this municipality. Then the profile of the nominee will be the major office in that locality. What was the topic? Reduction of the malaria cases. This will be the theme. So what is the justification? This is here we're going to describe in 500 words maximum what the actions were and what the impact that meant. What were the actions that lead to this impact? So we have this simple form written, and then who at the end of the page, we will need to add who fill the form. Why this is important is because we have said that maybe we can have someone who submit an application on behalf of a third party. So if the major office is not the one filling the form, whoever is filling it will need to also put the name and the institution of the person filling the form and the contact number, email and phone number. So this is the first phase. When this expression of interest reach to the committee, Malaria Champion committee, the Malaria Champion will review it and will send feedback to the nomination and will be asking for the detailed documentation. The detailed documentation will be more, as it is said, a more detailed documentation of the candidacy, of the nomination. So in this will be the second phase of the application this year. In this second phase, for the detailed documentation, we will need a detailed justification of the topic, the subject that was presented in the expression of interest, where we will have to be documenting the efforts that is being nominated, the impact of the effort, and what we will need also to consider documenting the challenges and the limitation of the action that is being considered for nomination. And as we've had in previous years, it is also expected that the candidate will want to document, to present audiovisual documentation to support the candidacy. And it will be very important, as we've seen, one of the three main retained topic that has been discussed last year is sustainability. It will be very good, very important to document the sustainability of the effort being submitted. So the detailed documentation will be returned the same way through the PAHO country office or directly to Alexander J. at parho.org. And when this detailed documentation is sent, the candidate will need to be on standby for any additional information. So as you can see here, the evaluation process will consider timeliness. There is time set for each one of these phases, completeness, and veracity. So I'm just making a summary here of the nomination process, of the application process. In March last month, the call for nomination has been sent out. It has been published, as I've shown, in the PAHO webpage and the different social networks of the organization. Today, we are just doing a boosting of this call that has been sent, and we expect to receive the expression of interest by the end of May. So May, June, the committee, the Malaria Champion Committee, will be reviewing the proposal for classification and for feedback to the candidates. Phase 1 will finish then by the end of June. In July, phase 2 will start, where we will be expecting the submission of the detailed documentation that will be asked from the different candidates. And then we will have the committee doing an evaluation of the different proposals in around September, October, so that by the end of October, the finalists will be selected and the champions will be recognized on November 6th, as we normally do it during the celebration of Malaria Day in the America. Thank you very much. This has been a short presentation, but taking you through the process. So we wanted to have this presentation so that we may, as I said previously, recap or return or use the opportunity to promote this Malaria Championship initiative, the call for nomination, and also to receive questions that we could clarify during this call. Please feel free to use the Q&A section if you have any question, and we'll try to clarify for you. Thank you very much. I have opened the Q&A session. I don't have any question yet. The session is available, right? The host.
That's correct.
Okay.
Yes, and you have one already, John.
Q&A questions. Thank you. Yes. Dolan, thank you for your question. Yeah. I'm going to say sorry it's open only for America, because it's going to be Malaria Champion in the America. Oh, sorry, Malaria Champion of the America. So we will not be receiving a nomination from other places, from other regions.
Jan, there is a question from Brazil.
One second.
Eu posso responder em português se você quer, ou I can approach in Portuguese if you want.
Sí, por favor. Yeah, please. Sorry, I'm putting it in Spanish. Yeah, please. But I don't see the question.
Okay, it's Elder Figueira from Brazil. Elder está preguntando informaciones.
En el chat, no en el Q&A. Sí, por favor. Please, go ahead.
The question is about if it is possible for a municipality or a state to submit more than one proposal.
Oh,
Yes,
yeah.
definitely, it is possible. There is not any restrictions on that. There is not any restrictions on the number of municipality by a state or by the country. Basically, one of the key ideas this year is to include more champions, is to recognize the fact that we really believe that there are several champions in the region and several people and teams doing fabulous things. So yes, definitely. Elder, você pode apresentar e o estado do Amazonas ou qualquer município pode apresentar mais de uma proposta. Obrigado pela pergunta.
There is another one, John, for you on the QA chat.
Yep. I'm looking at it now. Thank you. I've lost my QA section.
I can read it for you if you want.
Yeah, please.
Which is the deadline for the expression of interest? This is from Patricia Sanchez Bao. Thank you.
Oh, I'm in trouble here with my technology. So the deadline is 26th of May, which is a Friday. So, but we are not expecting. I mean, do not feel like waiting until the deadline to submit. Whenever you have whenever the expression of interest is ready, please send it because we are receiving them right now. But this will be our deadline to receive a candidacy for this year. Okay, I get my shot back. Is there any other question? No other question in the Q&A, in the chat.
I'm looking to the chat. There is not any additional question. But I think this is definitely a good opportunity also for us in PAHO to ask all the participants to help us during the coming weeks on the dissemination of the call. We really believe that one of the key difference and maybe one of the key improvements that we can do in this process is to try to be more efficient on capturing more experiences. Because as we mentioned several times during the consultation process last year, the idea is not only to recognize successful experiences, but we believe that one of the key objectives of this initiative is to promote and to stimulate. So the capacity of capturing more experiences is very critical. So I would like to use this opportunity for all the participants to help PAHO on the dissemination of the call and transmit the idea that the nomination process is easy. It's easy to do. No very complicated information is needed, and so there is a good process that will be implemented, as Dr. Alexander explained it very well, in order to make the evaluations appropriated in according with the different categories. So I think I really appreciate all the efforts from the people in the chat and in the meeting to help us in that. Yeah, Jan, I don't see more comments.
Yeah, no, there's no more questions.
So I think
actually, it is said that repetition is good for learning. So if I can just repeat exactly what you said, Roberto. I was also thinking the same way. If please feel free to share in your network with the university, with any stakeholders you're working with, not only from the ministry, as we're saying at the private sector, NGOs, all the institutions at the local level. Please encourage anyone you know is making a good effort on malaria to apply. And as Roberto said, it's don't feel like you have to be certain that you're going to win, because it's not just all effort that is 100% as successful. We can also look into effort that are being done that we can build upon to improve. We can use those ideas also to support improvement. And then maybe if an idea is not recognized as a champion this year, the idea can be improved next year and then can become a champion and being promoted for emulation by other places. So please help us to promote this call, and we can receive as many candidates as possible. So I think we are closing this session. I would like to give a big thanks for everyone who is celebrating a World Malaria Day with us this year.
Thank you everybody.
Thank you very much.
Thank you everybody for the participation, and I also thanks, and we really believe in the PAHO team that this is an excellent way to celebrate the day, the Malaria Day, advocating for this more, for efforts and for recognizing the efforts on improving the malaria interventions and basically accessing the more hard to reach and marginalized population. So thank you so much everybody for the participation today.
Before you leave, if you can allow me to clarify one point. Actually, I confused with the date. On the web page, we have a May 12 as the deadline to receive a denomination. I think it was Elder who asked this question. If I can correct it, please. May 12, we will be receiving as a deadline to receive the nomination this year.
Okay.
Thank you very much.
Thank you, everybody.
Thank you.